Hello everyone. Many men who undergo the penile implant surgery still have questions when it comes to their recovery. Therefore, I decided to make my 2023 update to address the most common questions after your penile implant surgery. Hello, my name is Jonathan Clavell, and I am a urologist who specializes in men's sexual health and penile implant surgery. Before I start talking about tips on how to recover from your surgery, I need to point out that this video should not replace the instructions or recommendations provided by your specific surgeon. If you have any questions, the first thing you should do is discuss with your specific surgeon. This video will be addressing recommendations for my patients, but can also be useful as a guide for other men who have undergone the procedure with other surgeons. If you are my patient, some of these instructions will also be provided in writing. And with that said, let's start. The day after surgery. It's the day after surgery. Surgery is finally done and you wish to know if what you are experiencing, what you are feeling, and what you're seeing is normal. So the first question that comes up: the only way we can get the tips of the inflatable cylinders to sit underneath the glands is by perforating the glands with a tiny needle that will get a string through the glands and allow us to pull those cylinders into the shaft. That will create two small bruises or dark spots in the glands. But no worries, these dark spots should go away within several days. If I am doing your surgery, most of the cases do not require a catheter and this burning sensation should not happen. However, if you had the procedure done and a catheter was placed in the urinary channel during your surgery, this can cause microtrauma to the urethra and can cause irritation. However, this burning sensation should go away after a day or two. Just remember to keep yourself well hydrated during your recovery. The more you pee, the quicker that sensation will go away. As we mentioned in our previous video where we discussed what to expect after surgery, expect to have pain that will require pain medications for 1 to 2 weeks. However, I will do my best to administer a nerve block with a long-acting anesthetic agent that sometimes can keep you free of pain for 2 to 3 days. Therefore, the first 2 days, which tend to be the most painful ones, you will probably do not need to take any pain medications. Once that local anesthetic wears off, expect to have pain for the first couple of weeks. In most occasions, the pain is not excruciating. It is manageable and you do not need narcotics. You can apply ice in the area starting the night of the surgery. You can apply ice even with the dressings on. My recommendation would be to put an ice pack on top of the dressings. Avoid applying ice directly on top of the skin because it can irritate your skin. It is also important to know that you might still have discomfort in the penis and scrotum for 3 to 6 weeks. Remember that for every surgery, everyone heals differently and everyone tolerates pain differently. You cannot compare yourself to others, but rest assured that by 6 weeks, almost everyone is pain-free. What medications do I need to take? Ever since I started to administer that nerve block at the beginning of the surgery, very rarely do we need to prescribe narcotics anymore, which is great. Prior to surgery, I will plan to prescribe you all the medications that you will need for after surgery. This way, you do not have to go to any pharmacy to pick up anything while you're recovering from surgery. I typically prescribe a total of 3 to 4 medications, 2 for pain and 1 or 2 antibiotics. Regarding pain medications, there is something that it is important to remember. It is not necessary for you to stay ahead of the pain. I do not recommend you to take pain medications if you do not have pain. Sometimes ice alone can help alleviate the discomfort. It is also important that you should not take all of the pain medications all at once. Just take the pain medications if you have pain. If you do not have pain and are only uncomfortable, do not take the pain medications. If you're my patient, the first medication you should take for pain is extra strength Tylenol, also known as acetaminophen, of 500 milligrams. This is a medication you do not need prescriptions for. Let me repeat that again. If you have pain, the first medication you will take will be Tylenol or acetaminophen. You can take up to 2 tablets every 6 hours. It is important to remember that you cannot take more than 4,000 milligrams or 8 of those tablets within 24 hours. If the pain continues, you can also take gabapentin, which is a medication that works well for shooting pains, also known as neuropathic pain. This one you will be prescribed to take twice per day. And as last resort, you can take ketorolac, which is a non-steroidal anti-inflammatory drug, similar to ibuprofen, but much stronger than ibuprofen. Ketorolac is of the same family of ibuprofen, so it is important to remember that you cannot combine ketorolac with ibuprofen. I'm going to repeat that again. In order to avoid complications and side effects, you cannot combine ketorolac with ibuprofen. You can take one or the other. And tip to remember is, if your pain tolerance is low, you can alternate between Tylenol and ketorolac every 3 hours. So if you take Tylenol at 12 p.m., at 3 p.m. you take ketorolac. Then at 6 p.m. you can take Tylenol, and at 9 p.m. you take ketorolac, and so on and so forth. You get the picture. What if you run out of the ketorolac and Tylenol alone is not enough to control your pain? Then you can alternate Tylenol with ibuprofen, up to 600 milligrams of ibuprofen every 6 hours. Please remember, you cannot take ketorolac and ibuprofen together, as you might have side effects if you combine these two medications. If you have allergies or problems with your kidney or liver, let your surgeon know in case we need to change any of these medications for you. Also, if you have any issues or side effects taking any of these medications, contact your surgeon's office right away. In most occasions, I prescribe 1 or 2 antibiotics that you will take for 1 week. One of those antibiotics you will start to take 1 day prior to your surgery. The day of the surgery, do not take them, because we will administer IV antibiotics upon arrival to the hospital or surgical center. The day after the surgery, then you can restart to take both antibiotics for 1 week. If you're traveling from outside of the country, in some occasions I will prescribe you a 2nd week of antibiotics for you to have just in case you need them in the future. This way, if you're back in your home country and there are signs of an infection during your recovery, you will have those as a backup. Most of the time, you will not need to take that 2nd week of antibiotics, but I prefer to be safe. Another medication that would be wise to take, and you can find over the counter, is a stool softener. Sometimes the anesthesia medications and or pain medications can cause constipation. If you're constipated, keep yourself hydrated and take stool softeners. You can take the stool softener of your choice, which you can find in your regular pharmacy. 2 to 3 days after surgery. If I perform your surgery, when you wake up from surgery, you will have a big bulky dressing that will be keeping your scrotum wrapped and tight to prevent swelling or edema. Your penis will be sticking out to allow you to urinate. The dressing in most occasions comes out 2 days or 48 hours after surgery. So if your surgery is on a Wednesday, remove the dressings on Friday. Beneath the wrap of your dressing is also a clear tape covering the incision. Remove that tape so you can start cleaning the incision right away. I will repeat this. When you remove the wrap around the scrotum, please remember to also remove that clear tape that is covering the incision so you can start cleaning the incision as soon as those dressings come off. The worst thing you can do after you remove your dressings is to assume that what you're looking at will be your final result. Just like with any other surgery, your anatomy and physical appearance will significantly change as your body continues to heal. With penile implant surgery, you will have swelling, you will have bruising that will change the appearance, and most importantly, at first, you are not aroused. Prior to your surgery and during your younger years, if you ever measured your penis, you measured your penis when it was fully erect and not while it was flaccid. When you wake up from surgery and during those first few weeks, your penis will only be partially inflated, and also the glans will not be engorged. This is like if you were measuring your penis during the flaccid state in your younger years. You need to allow your body to heal and avoid measuring until after you start cycling. Your final result will not be appreciated until at least 3 to 6 months after surgery and after regular cycling. Simple. Just use water and regular antibacterial soap. Try to avoid soaps with a lot of fragrance because those soaps can irritate your skin. You only need regular soap, and once you are done in the shower, pat it dry. Do not rub on the incision. You may still have some of that Hibiclin soap that you used prior to your surgery. I would recommend to avoid using Hibiclens more than the first few days after surgery. The Hibiclens is a strong soap and it can sometimes irritate the skin in your penis and your scrotum if you use it for too long. I typically recommend using the Hibiclens for the first 2 to 3 times you shower. After that, just use regular soap without fragrance, therefore avoid using Hibiclens every day. And remember, just water and regular non-fragrance soap will be okay to keep that incision clean. From day 1 to week 6. After penile implant surgery, you only have 3 main restrictions. Number 1, do not lift anything heavier than 10 to 20 pounds. Avoid heavy exercise. The reason for this is because the implant has a reservoir that is placed through your inguinal ring and into the abdomen, and when you lift heavy objects, that creates pressure in your core and that reservoir can herniate down into your scrotum. Anything that creates pressure in your core can increase the risk of reservoir herniation. This could be heavy lifting, straining, and sometimes even chronic coughing. Number 2, do not submerge your fresh incision in water. No bathing, no swimming, no hot tubs, no jacuzzi, no beaches. Why? We want to keep your fresh incision as dry as possible. Once the incision is healed, then you can get into the bath. You are allowed to shower, but I would recommend to avoid baths. Number 3, no sexual activity of any kind. I usually tell patients 6 weeks of abstinence leads to a lifetime of happiness. Let your body heal. If you have a knee surgery, you're not going to play basketball those first 6 weeks. Let your body heal. We want to prevent you from having complications, and using your penis for sex can lead to that. I know we usually recommend to point the penis up during surgery. However, when you have a partial erection and the tissues are still healing up, it will be difficult and sometimes near to impossible to point the penis up without having pain. You do not need to have the penis pointing up all the time. What I recommend is that if a man is alone at home, avoid manipulating it and just let it hang. Do not force it up to prevent tension on the incision line. The important thing is to not leave the penis pointing in one single direction while you heal, because if you point it to the side, for example, you can develop a curve that was not there before. So hiding your penis or masking that erection may be tough those first few weeks. Try to make the most of it though. Men come up with many different ideas to help conceal the penis, and here are some ideas I've heard from my patients. Number 1, biker shorts. These are strong compressive shorts that can be worn on top of your underwear. However, these may be too tight and sometimes uncomfortable for some men. To add comfort, some men wrap the penis with a short cotton sock and then put on the biker shorts on top. Then they wear baggy pants and a big shirt to hide everything. Number 2, men's underwear with pockets. 2 brands that many men recommend are Separatech and David Archie. These underwear have a separate compartment for the penis, which can help avoid contact of the penis with its surroundings. Number 3, others use underwear, cut the elastic band of another pair of underwear, and use that elastic band to keep that penis pointing up against the abdomen. Men who have the surgery done via an infrapubic incision are recommended to pull on the pump soon after surgery to make sure that the pump does not ride high. Why? When a surgeon places an implant via an infrapubic incision, all the components of the implant are placed through that incision in your lower abdomen at the base of your penis. The pump is navigated all the way down to the scrotum from that incision, and if that pump is not pulled down, you may run the risk of having that pump go to its point of origin, which may end up at the base of your penis. However, if you have the surgery done via the penoscrotal approach, it is very likely you do not need to pull on your pump during your recovery. This is one of the benefits of the penoscrotal approach. The pump is placed under direct vision into the scrotum, and therefore you do not need to pull on it. If you're concerned about the placement and wonder if you need to pull on it, just contact your surgeon and I am sure he or she can help guide you and give you a proper answer for your specific situation. Scrotal swelling is very common during your first 2 weeks after surgery. Some men develop significant swelling in their scrotum, which makes the scrotum feel like a water balloon. This is what we call scrotal edema, which is very common after any pelvic, scrotal, or inguinal surgery. The best way for you to help that swelling or edema go down will be with scrotal elevation. If you're laying in bed or sitting in a recliner, get a towel, a big t-shirt, or something similar. Get it underneath your scrotum to elevate your scrotum and allow that fluid to go back into your body. This is what the dressing I placed after surgery was for, to prevent your scrotum from filling up like a balloon. Also, avoid walking around with loose fitting clothes. Keep your testicles well supported until the swelling goes down. Tighter underwear can help. Some buy mesh jock straps like NDS Wear men's underwear that has a mesh for the scrotum and an opening for the penis to stick out. Others use the special underwear like we discussed before, Seprotec or David Archie. For the swelling, you can also use ice, even in those first couple of days when you have the dressing on. Feel free to apply ice on top of the dressing. When using ice, do not apply directly over the skin. Always try to have a layer of cloth or paper towel to avoid the ice from irritating your skin. Among penile implant surgeons, the term cycling refers to the ability to both inflate and deflate your implant. In order to maximize your length and girth, men need to cycle the implant regularly. As surgeons, we try to have men cycle as soon as possible, but in my specific patients, I recommend against cycling prior to 3 weeks. Why? The first few weeks after surgery, you will be sore, you will have swelling, and the area will be tender to touch. If you attempt cycling too soon, you will be in pain and then become anxious because you will feel you are failing to cycle or doing something wrong by not being able to feel the parts to cycle. Therefore, again, this is just me, believe that you will be okay if you withhold from cycling for a few weeks. Most men are able to cycle at 6 weeks, and that is why I want you to set your mindset for 6 weeks. This way you should not get frustrated if you're not able to cycle early on. However, if my patient is pain-free, is able to feel all the components of the pump, and the incision is mostly healed, in many occasions they can start to cycle as soon as 3 to 4 weeks, but mostly closer to the 4th week mark. How will you know if you're ready? Simple. Just contact your surgeon and ask him or her if you're ready to start cycling your implant. For men undergoing surgery with me, I tell them that most are able to have sex by weeks 5 or 6. I know there are other surgeons that say their patients are having sex by 3 to 4 weeks. Me, on the other hand, prefer to be safe rather than sorry. I also tell men that the first time they have sex will probably be like the first time they ever had sex with their partner. Both will be very gentle and be looking at each other, making sure that there is no pain. You can imagine. However, as time goes by, you should be able to perform just like you did before you had erectile dysfunction. When it comes to positions, there are no positions that need to be avoided as long as you keep sharp objects away from the cylinders. Again, by 6 weeks, you should be back to your usual self. In summary, remember you just underwent surgery. Like with any other surgery, do not expect to be back to 100% right away. If you have a knee surgery, hip surgery, ankle surgery, you need to let your joints recover, get rehab, verify with your doctor before you go start performing high intensity activities. It should be the same way after penile implant surgery. Always verify and clarify instructions with your specific surgeon. If you're still recovering, I know you might be anxious, but do not worry, it will be over soon and hopefully ED will be behind you forever. I wish you the best of success during your recovery. If you found this video helpful, please remember to hit the like button below, share it with others, and consider subscribing to our YouTube channel for more content to come. As always, thank you for tuning in. See you next time.